we have discovered various molecules of drugs and tablets and injections in order to get rid of endometriosis, but take it from me, nothing works. The only purpose of these medicines and tablets and injections is to delay the surgical treatment. And we have found patients by delaying the surgical treatment using those medicines, saying that okay, this medicine will work and it will take cure or it will take care of the endometriosis. We have seen that delayed surgery has resulted in permanent damage of patients. Really, take it from me, it is a very, very, very bad condition to have. Hello friends, today we are going to explain what endometriosis is, what are the symptoms, why it happens, and specifically when you should seek care. So at the end of this video, all these points should be very clear to you, and we will also include whether you need a surgery and when you need a surgery for this condition. So you need to know the real anatomy of the uterus. The uterus is actually muscular structure in which the muscle structure contains an inner lining called the endometrium. The endometrium is the main active layer of the uterus, inside which the baby, if conceived, it is conceived in that layer. And if the baby is not conceived, then every month, due to the effect of estrogen coming from the growing eggs, this layer is growing and becoming thickened so that it can support the incoming baby. But if the baby is not coming, the same layer is cast out, and along with some blood it comes out through the vagina, which is called having menses. So endometriosis is composed of two Latin words, endometrium and osis. Osis means to spread. In this condition, the inner layer of the uterus is spreading outside its natural location. That is, it is spreading either inside the body of the uterus or even outside the uterus. It is spreading mainly on the ovaries, on other pelvic structures, tubes, on the ligaments which are holding the uterus called uterosacral ligaments. Also, it spreads on the urinary bladder, rectum, colon, and the pelvic peritoneum, that is the covering of the organs inside the lower abdomen. Rarely it can spread even up to the upper abdominal structures like liver, stomach, esophagus, diaphragm, etc. Even we have found above the diaphragm, that is inside the lungs tissue, also inside brain spinal cord also we have sometimes found. That is a rarity, but for all practical purposes, endometrium is the spreading in endometriosis. The endometrium is spreading outside the uterus, inside mainly in the lower abdomen, which is the problem. And when the menses are occurring, that is the woman is bleeding from the inner layer, the layer has spread to other parts, that things are also bleeding, those spots are also bleeding, so that bleeding cannot go outside your body, so it will get collected, and when it is getting collected, the body tries to mount up a inflammatory response. In response to that bleeding, it tries to cover it up with some layers, by sending some signals. Some cells come from your blood and try to protect you from that bleeding. In that case, a inflammatory response is mounted by the body, and that is why the pain is there. So in endometriosis, if we take those cut sections and put under microscope, we will find that there is neovascularization, that is new blood vessels have grown over there, new neuralization, that is new nerves have come, and also it is compressing upon certain structures like the rectum, bladder, urethra, and also compressing upon some nerves, even up to the sciatic nerve it can compress. So this is the basic pathophysiology of endometriosis. Now these things that have spread, they are also creating or secreting some poisonous toxic chemicals in the surrounding areas, that is making the environment very bad for the eggs and the sperms required for reproduction. So that is the main pathway in which the endometriosis is causing subfertility or problems in reproduction, as well as that the puckering of the internal structures due to adhesions caused by this inflammatory response is going to alter the normal anatomy of the tubes and uterus, which is very essential for reproduction. That is why in the surgeries, when the surgery is done for endometriosis and it is done for conserving the fertility of the woman, then in this type of surgery our target is to recreate the normal tubo-ovarian relationship, and the normal anatomy of the pelvis is recreated through surgery by taking out those puckerings. That is also a part of the treatment. So basic thing is that what our understanding right now is that endometriosis happens due to spread of this endometrium layer outside the uterus and the inflammatory process that in due course it creates. So we are getting right now endometriosis patients even in teenage girls, in all sorts of reproductive age women, and also even postmenopausal endometriosis we are finding. Another question that comes to us is, doctor, does it turn into malignancy or cancer? Yes, we have found association with that also. A specific type of endometrial cancer has been found to be associated with long-term prevalence of endometriosis. It does not turn cancerous overnight, but ultimately that can also give rise when the woman should require to come to a doctor. For that purpose, we have defined pain to be whether it is sufficient or significant pain. The significant pain has got a definition. Significant pain consists of two out of the three things that I am going to tell you. Either the patient needs to lie down due to pain, saying that she needs to hold her abdomen and lie down. Number 2 point, she needs to take painkillers in every day of every cycle of her period. Third point, she has work absenteeism, that is due to the pain during period she cannot go to or perform her day-to-day activities, including the school child cannot go to school, college girl cannot go to college, and working woman is sitting at home losing her job. So if two out of these three things are positive, then that pain is significant pain and that woman needs to be evaluated. Now how she is to be evaluated? The baseline investigation is a ultrasound. As you know, if something bad is found in the ultrasound, then the disease has progressed a lot, but before that we can catch the small changes of endometriosis very early on if we get an MRI pelvis done. There are softwares called endometriosis protocols in which the MRI pictures are stitched together in 3D vision, and then we can make out those small deposits which have occurred inside the lower abdomen, and we can pick up an early stage endometriosis and begin its treatment. Now mind it, we have discovered various molecules of drugs and tablets and injections in order to get rid of endometriosis, but take it from me, nothing works. The only purpose of these medicines and tablets and injections is to delay the surgical treatment. And we have found patients by delaying the surgical treatment using those medicines, saying that okay, this medicine will work and it will take cure or it will take care of the endometriosis. We have seen that delayed surgery has resulted in permanent damage of patients. Sometimes the thing goes inside in spite of getting the drug, and it ultimately results in an aggressive form of endometriosis known as deep endometriosis. Deep endometriosis is completely different from superficial endometriosis. From the name itself, it is clear that the lesions have gone deep inside the normal tissue and they will not respond to this type of hormonal treatment, non-hormonal treatment, painkiller, any medicine, diagnosis, endogolics, whatever you want to give, it is not going to respond to that. Only treatment for that is surgical removal of surgical excision and removal of those small parts in which the spread has occurred. So this is the basic structure of endometriosis and its learning, and this will help you as a patient to understand what you are looking at. I have told some of my patients, madam, after reading about this disease, I could have got a diagnosis of cancer that would be a better prognosis for me than this disease. Really, take it from me, it is a very bad condition to have.